eradication is a public health program through which a disease ceases to exist and you don't have to do any further interventions. Now, let us come to the situation with cervical cancer. As I said before, cervical cancer is eminently preventable because 95% of the cervical cancers are caused by a virus, which is we call human papilloma virus. So, if it is a virus, obviously now you understand because of the COVID situation and all that a vaccine can be developed against a virus, and against human papilloma virus we have wonderful vaccine. This vaccine is very safe and it is very effective, and right at this moment we have evidence over more than 10 years of the vaccine being used in several different countries, given millions of doses, and it has been found to be extremely effective in reducing cervical cancer. And interestingly, this virus also causes a few other cancers, say for example anal cancers, oropharyngeal cancers, that means a type of cancer in the throat. So, all these cancers are also prevented by the vaccine. So, anyway, let us come back to the elimination story. So, because of the vaccination, if we because of the availability of the safe and effective vaccine, if we can vaccinate our adolescent girls before they reach the age of 15 years and we can have a high coverage, say for example 90% coverage of the girls, we will be able to stop cervical cancer. But then we will also have to think that at the present moment there is a large number of women who are beyond the age of 15 years who are at risk of developing cervical cancer. So, they need also something to prevent cervical cancer. So, for them we need screening, and now screening technologies have improved quite a lot. We have excellent tests, just like the COVID testing is done with RT-PCR tests using the machines. Those same machines, same technology can be used to test for cervical cancer. So, if we can make sure that our women at least twice in a lifetime they are screened for cervical cancer, if we can make sure that our adolescent girls are vaccinated against human papilloma virus, cervical cancer can be eliminated. So, cervical cancer incidence will not come down to 0, but then it comes down to a certain level at which we consider it that it is no longer a public health problem. At the present moment it is a huge public health problem, but then if we can do vaccination, if we can do screening, it will cease to be a public health problem. But then unlike smallpox, we will have to continue with the vaccination, we will have to continue with the screening. So, that is the basic difference between eradication and elimination. After elimination, we still have to continue with the vaccination and the screening intervention, but then it is feasible. In fact, in another 2 to 3 years, Australia is going to eliminate cervical cancer and will be the first country to do so in the world. The next will be followed by Sweden, next will be followed by United Kingdom. So, many of the countries are already in the path to eliminate cervical cancer, but then in India we need to think in a different way.